Hello and welcome to yet another episode of Dr. Sin. Today we have with us Dr. Syed Sakib Nasir, who is an interventional cardiologist from Zahra Hospital, Dubai. Let's welcome him to the program. Welcome, doctor.
Thank you.
First of all, we would like to know more about you.
Well, as you said, I'm a cardiologist. I'm an interventional cardiologist, and I specialize in treating patients who have got narrowing in their heart arteries or who are having heart attack. I tend to treat them by opening up their heart arteries by doing procedures called angiogram and angioplasty. So this is what I do, I specialize in, but I am a general cardiologist. You may be asking me what type of patient I see.
Yes.
You see, in our outpatient clinic and in our hospital setup, we see three groups of patients. The first group, they are healthy people, but they would like to know if they are at risk of having heart disease, because often heart disease cannot manifest. They may stay there and show up in a late stage when it will be too late. So these group of apparently healthy people, they come to us to find out if they have got a problem.
Yeah.
So this is the main group we see. The second group, they may or may not be healthy, but they do have symptoms. That means they are having some difficulties or issues. That's why they come to us. Now, the commonest cause for these is high blood pressure. As you know, this is the commonest condition, heart condition worldwide. So, high blood pressure, people can come with palpitation, a problem with the heart rhythm. Sometimes people come with dizziness, fainting attacks. Besides that, the two serious symptoms are chest pain, okay? Because if this is due to the heart, then patient is at risk of having a heart attack or sudden death. And the second sort of serious symptom is breathlessness. That means breathing difficulty, not related to the lungs or any other condition, and if it's due to the heart, then it can be serious.
Yeah.
So these are the first two groups, and the third group falls into the category what we call cardiac emergencies. So these group of patients, though they are smaller group, they come through either emergency or direct referral from other doctors in a very terrible state, like having chest pain, having very low blood pressure, unconscious, having very fast or alarmingly slow heart rate, or severe breathlessness.
Okay.
So this is the most critical serious group which we do see. Though the numbers are not very high, but as I say, these are life-threatening condition. And the essence of our management is to treat this patient very quickly and efficiently.
Okay. So now coming into chest pain.
Yeah.
So what are the causes of chest pain and how can we prevent chest pain?
I think in UAE, the population is pretty young. And according to my experience, the young patient, when they complain of chest pain, is less likely to be due to the heart.
Okay.
But having said that, more and more younger patients are developing heart condition in this part of the world because of their sedentary lifestyle, lack of exercise, unhealthy food habit. So they are developing premature diabetes, obesity, and heart disease. So when someone comes to my clinic with chest pain, I took it seriously, knowing that it may turn out to be normal, but we need to rule out heart disease. And the condition which gives chest pain is called coronary artery disease. That means narrowing due to cholesterol deposition in the heart arteries causes blood flow limitation. And that can come as chest pain, and in medical terms we call it angina.
Okay.
And the problem with this is that often we ignore it. We said, oh, it's a bit of acidity perhaps, anxiety, but it could be heart. And as you know, people do die suddenly from heart attack. So any chest pain, I think, should be taken seriously and needs to be investigated.
So now could you just tell us more about heart attack?
Right. Okay. Heart attack is a dynamic process, and it happens in those people who has got multiple risks, say, age above 40, has got family history of heart disease, smoking, having diabetes, high blood pressure, high cholesterol. These are all risk factors. The more someone has got these risk factors, the higher is the risk of having heart disease. Now, in heart disease, what happens, cholesterol or this fatty substance deposits inside the heart arteries, and it can make it narrow. Now, the narrowing of the heart arteries can give someone chest pain, but the problem is when this cholesterol deposition or plaque, we call it, if they get ruptured, they can get ruptured, then they get exposed to the blood. And blood does not like cholesterol. As soon as this cholesterol gets exposed to the blood, blood starts to get thicker. And eventually, a clot can block a blood vessel entirely, causing damage to the heart muscle. And the patient in these sort of circumstances gets significant chest pain at the front, at the back, arms or jaw. They perspire a lot. They can feel breathless. Some people say, oh my God, I was about to die, I was about to faint. So these are the symptoms. I tell my patient, look, if you develop any chest pain which alarms you, which frightens you, then you need to go to your nearest ER. Here I would like to make a point. You see, we do have a lot of diabetic patients in the community. And if someone is diabetic for a longer period of time, they don't get usual chest pain, the classical chest pain. Okay, now this is something to notice. I just give you an example. I've just done an angioplasty in a gentleman who's younger than me, but he's diabetic for 15 years. And he came to me twice with unusual symptoms. He says, doctor, I don't feel right, I feel a bit breathless, I don't know what's happening to me. He never mentioned about chest pain. Knowing that he's diabetic, we did do some tests, and it showed that he does have narrowing in the heart arteries. I think you may be asking me now, what is angiogram and angioplasty? So let me have the privilege to explain you. Angiogram is basically taking pictures of the heart arteries, right? What we do is that under local anesthesia, we go either through the wrist artery or the groin artery. We put a tube in, and through that tube we pass longer and finer tubes which reach up to the heart. And we do this procedure under X-ray guidance. So we can see where all these tubes are going, and we inject a dye or a contrast to opacify the blood vessels and take picture. So angiogram or angiography means simply taking the picture of the heart arteries. It takes about 10 minutes to do the procedure. It's fairly safe procedure. Once we have done the angiogram, if it's normal, fine. If it's abnormal, if there's any critical blockage, then through that same tube, we can pass fine wires, balloons to stretch the heart arteries. And once we have stretched it, then we put a tube, a wire mesh, we call it stent, metallic tube, which goes and keep the artery patent. It acts as a scaffold. So this is stenting, and this procedure is safe and life-saving, mainly when someone is having heart attack. So angiogram and angioplasty is the first line of recognized treatment worldwide for patients who are having heart attack.
So now coming on to valve disease. What is valve disease actually?
What is valve disease? Yes, right. Okay, let me just explain you about the heart. Whenever we talk about heart is a piece of muscle. It's a muscular organ which is a pump basically, and it circulates blood throughout the body. It circulates blood into the lung to get the blood oxygenated, and it supplies the entire body and in general. Now, as it is a pump, it has got 4 valves inside to allow the blood flow to go through one direction, to maintain a circuit. When we say valve disease, that means there's some problem with the valve. Either it's not opening fully or it's not closing properly. So these are the two commonest problems with the heart valve disease. And the valve can be affected through infection. It could be due to old age, wear and tear, or there may be some rare forms which can affect the valves. So starting from a young child to a very elderly person, they can be affected with heart valve problems. You may ask me, what are the symptoms of heart valve disease? Commonly they present with tiredness, lethargy, and breathlessness. Okay, they may feel dizzy. They may start noticing swelling in their legs because fluid's been retained. So mainly it's lethargy, tiredness, reduced exercise capacity, and breathlessness.
Okay. So what is abnormal heart rhythm now?
Heart rhythm, abnormal heart rhythm. Yeah, as I said, you see, heart is a muscular structure, but it has got few components inside it. Muscle itself, and then we have valve, and there's an electrical circuit. All right, there is a battery inside the heart which we call pacemaker, and that keeps firing electrical current to contract the heart. So there is an electric wiring network which allows the current to flow in the entire heart. If there's a problem with this battery or with the wiring network, then people can experience some say heart rhythm problem. Now it could be very slow heart rate, very fast heart rate, or irregular heart rate. So it varies. Now palpitation, as we call it, is a very common symptom. I see a lot of patients with palpitation, but believe me, most of them are not sinister or serious. But in some group they may be serious and they need to be treated very aggressively. I am seeing more and more people, especially young people, coming to me with heart rhythm problem or palpitation, and we have found out that the commonest cause for this is excessive drinking of caffeine, coffee, fizzy drink like Coke. It also contains caffeine. Energy drink, too much of smoking, stress, unhealthy food, lack of rest. These are all causes of having some form of heart rhythm problem or extra heartbeat, we call it. So this is fairly common. My suggestion would be, if anyone feels some funny sensation in the heart area, they should consult a doctor to rule out the not so common serious heart condition. And people who are having the common non-serious heart condition, they have to have proper advice regarding their lifestyle modification. If they follow it, then they shouldn't be feeling any palpitation.
Okay. So what are the advice that you usually give to your patients?
Right. My advice is very simple and very old-fashioned, you know. I'm a great motivator of exercise. I tell my patient that they should eat healthy. When I say healthy, I mean more fruits and vegetables and less red meat and animal fat, oily stuff. I also enjoy my burger, my kebab once in a while. I have to, because you know, we are human beings, we love food. But we should not be indulging ourselves to frequent takeaways, fast food. So we need to look at that. We need to observe what we are eating, what calorie we are eating. So I tell all of my patients, look at the level of all these food. Try to understand your calories, try to understand the fats and the salts. So it's a matter of understanding them. Exercise, you know, exercise is mandatory. Believe me, there are hundreds of advantages of exercise, but people tell me they don't have enough time. And I think they're trying to find an excuse. I think we're getting lazier in our daily life. We are so busy that we cannot make time. So exercise minimum 3 days for 30 minutes is good enough. So eating healthy, regular exercise, and third thing is soul for the food for the soul. You know, you have to watch movies, you have to listen to music, you need to understand how to relax.
Yes.
Because that is one of the important ways you can release your tension. So these are the 3 things we should think about. And yes, people should be health conscious.
Yes.
If there's something wrong in the body, because you know, you get the vibe, you understand, go and have a checkup. There's no harm.
Okay.
In most of the cases, it's normal, and it's good to know everything is normal.
Yes. That's so. What are the causes of heart failure?
Heart failure, right, again, it's another topic. Heart failure is a condition where heart as a pump fails to perform, right? So as you know, heart is beating about 70 to 80 times per minute, and it's circulating this blood in our entire body. If some reason, if the heart muscle becomes weak, then it cannot pump sufficient blood, and one feels tired, lethargic, breathless. So this is heart failure, and there are a lot of causes for heart failure. That means causes that can make the heart muscle to go weak. The commonest cause for heart failure is coronary artery disease, as I mentioned, narrowing in the heart arteries, or if someone had a heart attack and not been treated in time, the heart muscle can get damaged and it can become weak. So that's number 1 cause of heart failure. The second commonest cause is high blood pressure. If someone is not controlling high blood pressure adequately, their heart will eventually becoming weaker and weaker. The third condition is valve disease. If someone has got an abnormal valve, which is not being treated properly, then the heart will fail. And there's another condition of the heart muscle itself, a disease of the heart muscle, which is known as cardiomyopathy. Interestingly, this can happen to anyone with a simple viral infection or some other rare disorder. Rarely it can be related to pregnancy. So you know, any woman who is pregnant or has just delivered a baby and complains with breathlessness, we always try to look at the heart just to ensure that their heart muscle hasn't gone weak and they're not suffering from heart failure. So any pregnant woman, if they have noticed a bit unusual or undue breathlessness, then their heart needs to be checked.
Okay. So doctor, that was nice talking to you. Thanks a lot.
Same here, same here. Thank you for inviting me.
So that was Dr. Syed Sakib Nasir with us. Until we meet next time, this is me, Naina, signing off. Take care.